We also should have ethical skills, and this is the ability to understand the principles of ethical conduct and the ability to apply them appropriately in the context of dental practice. And this is basically we'll be looking at, right? We also should be political advocates. And this is where you have the ability to help groups and communities recognize their own health needs and goals and to organize to achieve them. Not necessarily to be a part of a political party and then you're going about their duties or whatever they assign you to do. Right? As a dentist, you also need to help the communities in which you work in. Right? Now, the social context of oral health. So, dentists and patients have very different views about what is meant by good oral health. Right? Now, the first involves the biophysical wholeness. Now, this approach involves identifying biological disturbances or ruling out the presence of disease by recording its absence. So disease is determined by medically defined abnormalities in anatomical structures or in psychological, physiological, or biochemical processes, right? So the aim of this is basically to identify any pathological abnormality diagnosed by science that signify the existence of a pathological lesion. And in dentistry, we can say caries, right? So this basically makes you into a detective and you are basically responding to the symptoms reported by the patient. Now, the alternative definition is the one that is presented by WHO, which basically defines health as being different from the absence of disease. Rather, it is a state of complete physical, mental, and social well-being, right? Now, this definition is welcomed as providing a positive perspective to health with an emphasis on the social context and the well-being of the individual. So we just stated the dentist and the patient have varying perception of health, right? So a study that was done, these are with the French people, and this is basically one of the first studies that was done on this topic. They defined health, or they had three ideas about health. Now, they said that you have good health if there's an absence of disease, and this basically describes health in a vacuum. Now, the second, they said being able to resist or cope with illness, right? And then the third is the complete state of holistic well-being, equilibrium, which was rarely attainable. Now, these ideas have been noted in other studies, although terminology may differ. Now, in a sample of older Scottish people, Williams in 1983, he basically identified some other ideas by these older folks. They said health can be defined as the absence of disease, balancing strength and weakness, and being able to take part in normal life, or it has a functional definition. So when you go through the different levels or the different ages, even the social classes of individuals, you will have different ideas about person's perception of health. Now, other studies have also demonstrated variations between different social groups. Now, De Houtard and Field, they found that respondents in professional and clerical occupations had positive ideas about health, and their definition corresponded with WHO approach. Whilst respondents in manual occupations, they use more negative ideas, tending to define health as the absence of disease. Now, this difference, again, it might reflect the social background, as respondents with more years of formal education might have more ability to develop abstract ideas about health, right? Now, however, Blackster, he found little variation between respondents who generally chose the idea of absence of disease with the following exception. So young men were more likely to view health in terms of physical strength and fitness, whilst young women were more likely to answer in terms of energy, vitality, and the ability to cope. Now, middle-aged respondents, they viewed health in terms of, and the women were more likely to include good social relationships in their relationships. All right. So these are the different views, as I mentioned before. There's different classes, different age groups. Persons will give you different ideas or perception of what they think health is. All right. So I'm going to ask you guys. You are young idea about health.
Excuse me,
Three
I didn't get.
answers. All right, I'm asking you guys. I need.
I'm not sure if it's my internet, but you're kind of breaking up, Doc.
I'm having the same problem too. Did anyone hear doctor?
Oh, I think it's probably on Doctor End.
Okay, you guys can hear me now?
Yes, Doc, we can hear you now perfectly.
Great. So I'm asking you guys, what is your idea about health? It doesn't need to be the definition of health. How do you view or see health as a younger group of people in Guyana? Three answers.
Doc, I would say that when we see health as okay, younger people, as you said, we see it as being physically, mentally, emotionally, sometimes fit, well, as would have learned previously, not the mere absence of disease.
Right? So these days, basically, we know about mental health is on the rise. Persons are becoming more sensitized about these issues. All right, compared to years ago when persons were marginalized about, talking about mental health issues, right? So it's basically all of these things are being put to the forefront, and health is being the individual health is being recognized a little bit more. All right. Now, another factor that affects challenges in achieving oral health in dentistry we have is understanding the cultural background of the patients that come to us, right? And it is very important to understand where a person grew up or what their cultural background entails, right? So these ideas are important to practitioners in a multicultural society such as Guyana, and cultural beliefs about the sources of illness and correspondingly appropriate forms of treatment may be interpreted as providing a barrier to professional. Right? So many members with Western diagnostic techniques and treatments, and thus be anxious about taking advantage of Western interventions. Right? So we know that we have a lot of ethnic groups with a lot of cultural beliefs in Guyana, right? We know some people believe in bush plants, right? If they have any disease, they tend to turn to the bush medicine, right? Until it really gets out of hand and they come to visit you, then then they'll open up about these. So you need to be understanding and give them the appropriate advice that is needed. Right? So as young professionals, you need to educate yourselves about the cultural background of the patients that are coming to your clinic. Now, healthcare providers' ignorance of cultures can also impair their communication with patients And this results in culturally irrelevant services or misinterpretation of side effects of folk medicines. So successful communication requires recognition and consideration of cultural diversity and differing communication skills. Now, ethnocentrism, health professional basically dismisses the beliefs of persons held by other cultures, right? And this in itself creates a barrier, and this leads to misunderstanding. All right, so we need to be very open-minded when we're treating our patients. Now, health professionals would benefit from deeper understanding of cultural beliefs and practice, and the acknowledgement of respect for these practices, and may also improve the health of healthcare services. So let's look at what is oral health. Now, oral health, you guys can hear me? Saw the
Yes,
internet
we
was a
can
bit
hear you.
unstable there. All right. So oral health is a standard of health of the oral and related tissues, which enable an individual to eat, speak, or socialize without active disease, discomfort, or embarrassment, which contributes to the general well-being of that individual. So basically, it is a state of being free from mouth and facial pain, oral and throat cancer, oral infections and sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. Right? So how do we measure oral health? So the ability to measure the conventional measures of dental disease, such as the DMFT index, right? This has been a problem of itself because this index basically measures the dental history of the patient rather than the current dental health, right? So a patient may be missing his or her teeth because of a planned extraction due to crowding. It may have never erupted, or it may have been lost due to an accident, right? Instead of dental caries, all right? So all of these factors we need to take into consideration. So the conventional dental measures, such as the DMFT index, are based around professional judgment of the presence of disease, but there is a question about reliability. So it has been argued that clinical assessments are too narrowly based, given insufficient attention to social consequences of oral conditions. Often the effects of a condition cannot be predicted by the knowledge of the severity of the impairment. All right, everybody with me so far?
Yes, doctor.
Any questions? All right. So we just mentioned impairment, disability. So we'll just look at these, right? So WHO has proposed that a distinction can be made between the objective pathology that a person may have and the disease social and psychological effects. So impairment, it can be used to refer to any physiological or anatomical loss or abnormality of structure or function, right? So for example, if a person loses their teeth, this is basically considered an impairment, right? This leads to a disability because this basically imposes some sort of limitation on how the person chews their food, all right? So many persons learn to live with their symptoms and come to an accommodation with the limitations imposed by the disease. Now, a term is handicap, and it can be difficult for a patient in the society, right? So the person has some sort of difficulty there, right, to carry out their duties. Now, in this way, two people can share the same impairment, but not the same handicap, all right? Now, the socio-dental indicators of oral health. So clinical measures, it concentrates on impairment while neglecting disability and handicap. So the socio-dental indicators, they measure the extent to which the dental and oral disorders result in changes in behavior and disrupt the ability to carry out everyday social rules. So it is clear that some of the oral conditions, such as facial cleft palate, can have a lasting and severe consequence on social and sexual relationships. Now, edentullousness is also included since the wearing of dentures involves not only disabling problems such as the inability to choose certain foods, but also mandibular dysfunction such as headaches and social problems. Now, for example, if a denture wasn't crafted properly, these are some of the effects that will happen, right? The person will have TMJ problems. They can develop fungal infections at the corner of their mouth, angular cheilitis. They can have headaches, right? So this in of itself is disabling to the patient, all right? So the person in these circumstances, if they're invited to go out somewhere, they can basically refuse invitations. And some persons even avoid speaking or even smiling. All right. So the ideas proposed by WHO have been used to develop scales such as the scale impact profile. And this is designed to measure the effects of health difficulties on physical disabilities and social rules. So these measures are now recognized as providing better indicators of need than clinical measures alone, such as the DMFD index, because they do not rely solely on the professional measures of the disease, but includes the layperson's perspective. So let's look at social class. We mentioned this before, that different social classes of individuals have different ideas about health. Right? So there are four possible explanations. We have the artifact explanation, and the result shows a relationship between social class and health are not really present in the community, but are only due to the way the data was collected. Right? This is one of the differences. Now, the social selection explanation. Now, this proposes that health inequalities are created by a process whereby the healthy move up the social hierarchy and the less healthy move down. Now, a person who is initially unhealthy, they may find great difficulty to find skilled employment, so they may need to take a well less paid job. Conversely, a person who is healthy, it's easy for them to gain higher educational qualifications, say they basically move up the social scale. Now, the materialistic explanation. Now, the inequalities in health, they're stating that it has origins in social and financial deprivation. Now, even though there has been improvements in healthy standards, the social classes live in relatively more unhealthy environments. They do more dangerous and insecure work and have more poorer housing and lower incomes, right? So these factors are assumed to interact together and they have a cumulative effect. Sorry. Now, behavioral explanation. Now, this basically explains inequality in terms of differences in knowledge and behavior, right? So they're basically saying if you don't have the knowledge to practice the right action or behavior, basically you won't perform it, right? So if you have limited knowledge on the role of diet and about regular preventive care, right? More than likely you won't practice it, right? Your lifestyle won't be about that, all right? Now, people with higher social class parents, they are more knowledgeable about the causes of dental decay, and obviously they will pass this knowledge on to their children, right? So they will practice these behaviors and they will have a better outcome with their health. So which explanation is correct? It seems that both the materialistic and the behavioral socioeconomic differences in oral health. So their contribution is thought to continue from childhood throughout adolescence and adult life. Any questions so far? No?
No from me, doctor.
All right. Let's move on to the contribution of the dentist to look at the changing patterns of disease. So there are two reasons to believe that professional dentistry has had only a small impact on prevalence. So the first is that not everybody attends the dentist on a regular basis, whether to receive treatment or preventive advice about the use of fluoride. And the second is the contribution of health services to health in general. This have been critically reviewed, and McEwan concluded that the decline in mortality predated knowledge about prevention or effective treatment of diseases such as tuberculosis. Having the greatest impact upon improvement in health, we have better food, environmental improvements, for example, better quality of the water supply, and a reduction in the average family size. Right? So if you have less members in your family, you should be able to have more finances to distribute and overall. All right. Now, health promotion and health education. So health promotion is defined as the process of seeking to improve or protect health through a range of activities, including economic and environmental policy change. Now, more specifically, the range of health promotion activities includes the health education. This is where we give information about health, offering and trying to encourage the development of personal self-confidence, right? So opportunities for this exist in situations. Example, the schools and the dentist-patient contact. Now, the media, they have also been providing some amount of information, and is non-personal. Media cannot be focused on an individual's specific and positive health services such as smoking cessation programs. And these special initiatives might be planned for those patients who are unable to access professional physical environment more conducive to health. So this includes designing buildings better to reduce the chance of dental trauma in children, or the optimal adjustment of the fluoride content in water to prevent dental caries. The fourth is basically involved in the community, right? Either to develop local services or to form self-help or pressure groups. Now, at times, the ministry in of itself, they can organize outreaches, right? And these outreaches can have a good or bad impact on the community, right? Depending if then you can achieve better oral health from the members of the community. If you don't, you may leave the community worse than how it was before, right? Now, there's also organizational development. And this involves the implementation of policies that promote the health of staff and their clients, such as providing no smoking areas or healthy catering services. And then we have economic and regular activity. So if the government changes taxation to make products more or less expensive, or the development of a controlled advertising of health compromising products, right? So for example, we know that cigarettes, the health, the ministry and other agencies within health, they have been making advertisements about smoking for a while, right? To sensitize the general public so that they can make better decisions. Now, practice implications. So because most people support a negative definition of health, which is the absence of disease, we face a very important challenge, right? So there is a risk that health may be seen in public as something taken for granted, only thought about when symptoms arise or it interferes with daily life, right? So the challenge is not to give information, but to develop ideas about health so that people feel more positive. And we know that this is a cursing animal, right? Persons tend to visit the dentist when the teeth cannot be saved. Only of recent, like a few years ago, then coming in, or people are being more sensitized to come in regularly and get their oral health work done, right? So health in general and oral health specifically, right? So studies have shown that the values of the dentist, it does not correspond with those held by lay people. Now, older people may present challenges for primary dental care because of the need to consider the impact of systemic disease upon oral with primary medical care teams. So ill health is only a result of failings in the health service, but it also links in care and managing the other members practical. All right. We'll cross that when we get to that course.
But as of now, the line for now.
So Hadi, are you in the class rep?
Yes, Doc.
Okay. So I'll get familiar with you guys. 11 of you in the class.
We are to finalize that also.
Okay. All right, because what I do, I usually send, you have presentations to do, mind you.
Okay.
So I usually send that early in the semester so that you guys can prepare for that very early. And when the time presents itself, all right. So you will be in groups for your presentations. So I will send that as long as the list is finalized. All right.
Yes, Doc.
Another thing is the course outline. It was posted in the group. What topics are for test one, please? I don't need anybody asking me what topics are coming when it's all right. The only thing is that this semester I will be teaching forward some of the presentations. So some of the classes or the presentations that are a bit shorter, we may do 2 instead of 1 during the time free. All right. So